Hello everyone. I wanted to help clarify the directions for our Unit 5, Week 13 final practical application assignment in our 6215 first pharmacology course. So during Unit 5, we're looking at medications that provide comfort, deal with analgesia, and also do work on decreasing inflammation, which we know is a source of discomfort or pain associated with arachidinic cycle and some of the leukotrienes and other Ig mediators. So what we would like each of you to do for this particular practical application assignment is to look at a couple of different things. And the first thing is, let me review to clarify the assignment. This is an assignment that can be done with your peers. You can work as a group or you can work individually, whichever you choose. If you are using resources, we do ask that you would use in-text citations using the 7th edition of the APA manual. And in the unit and in the assignment, there is information related to guidelines that would be used for you related to the diagnostic category that you have been assigned. Make sure that you try and use as many of your own words as you can to explain this. I understand that some of the technical language, there's just no other way to say that. But let us know that that you understand what you're saying, if that's okay. So what you're going to do is to compare and contrast some different medications in each of those columns that are attached in the worksheet. And let me just pull that up real quick for a second so you can see that table. So here's the table, and just to kind of review the directions, what you're going to do is complete the table as requested based on the diagnosis that you've been assigned to. Each student is going to choose 2 centrally acting opioids and discuss the 3 different characteristics: pharmacodynamics, pharmacokinetics, and pharmacotherapeutics associated with that. You're going to choose 3 of the NSAID category drugs, and this is so that you guys all become familiar with at least 2 or 3 drugs in each of those categories, and you're going to move forward and remember those. And as you start to look at different diagnoses and also begin to prescribe as a student family nurse practitioner, you'll have some expertise in your bag that when you go to the clinical sites and be able to pull up this information again. So 2 centrally acting opioids, that's category number 1 in column 2. 3 NSAID category medications, that's column number 3. And acetylsalicylic, ASA, acid, and acetaminophen, and that's in column 4. All of you are going to look at both those drugs because they're used so readily. And then you're going to choose 2 corticosteroids from column number 5. And then the final column, column number 6, there's 2 to 3 diagnostic specific medications, which I'll show you in a minute. And then you're going to choose a medication that you would prescribe under each of those categories. So for example, you're going to choose a centrally acting opioid. So for example, for gout, I'm going to use fentanyl because that's the one that I chose to investigate of the 2 drugs. But what I'm going to say is that I would not recommend that, which is right here. So for example, gout can be quite painful. If you needed a centrally acting opioid for 2 to 3 days, which one would you choose? So I just told you I'm going to use fentanyl, which probably is not a good choice. And you guys can decide based on what you're learning about that versus the others why that's the case. But my rationale for choosing that is that it's the best one for pain management in my perspective based on the information I shared. But I would never prescribe this classification of anti-inflammatory pain medication or comfort medication because it's not warranted for gout. So likely what I would do is then go back and choose an NSAID that might work if that's appropriate for pain management, in addition to the gout medication. And so, for example, under some of the medications that are listed under gout, let me move on down there so you all can see that. So before I do that, here is the different categories. There's 6 of them, and there's 3 or 4 students assigned to each category. So this is something you should be able to work on together, share your information in the table, and then submit that in the assignment and be ready to talk about it when we meet next time on campus. So for example, on the gout medications, I could choose colchicine, allopurinol, or probenecid. And some of these are better for an acute gout scenario, and some are better for a chronic. So that would determine potentially which medications I might choose in this category. And I could look at cortisone, prednisone, triamcinolone, betamethasone, and methylprednisolone. And some of these would not even be appropriate for this diagnosis, and I'll let you figure that out. But I could always use aspirin or acetaminophen, right? Or I could use one of these other medications that are under the non-steroidal anti-inflammatory medications, the NSAIDs. So if I was to move on down to osteoarthritis, for example, I might decide that hydrocodone and acetaminophen might be a good drug of choice from the centrally acting medications, because sometimes osteoarthritis can be very, very painful, and maybe I'd prescribe that for just breakthrough severe pain to allow somebody to sleep a little bit better at night. Maybe I don't. Maybe that's not a wise choice, but that's something I can decide as a prescriber and how I would use it. I might also look at one of these others here, and I might choose Sulindac because I know that works pretty well on the process of osteoarthritis. I'm going to let you look at why that may or may not be better than ibuprofen or naproxen. I could potentially use some prednisone if I needed to calm down an acute flare-up. And then there's some other medications over here, which actually for this category, most of the osteoarthritis medicines come from these 3 middle categories. So moving on down to rheumatoid arthritis, I can choose to use a non-biological DMARD, or I might use a rheumatoid arthritis medication such as methotrexate, or maybe I would use Xeljanz, and that again would depend on the circumstances of the arthritis, how severe and how acute it is. And again, for acute pain, I might consider something for breakthrough pain from the opioid centrally acting category, or I may find that the choices over here would be better as well. And the other thing that you need to remember about rheumatoid arthritis is that actually there is some autoimmune modifiers in there, which make this a little bit different than osteoarthritis. And you're just going to keep going on down through this list. For osteoporosis, kind of the same thing in these first 4 columns. First 5 columns. And then there's some specific medications here, and this might depend on what a DEXA scan shows or the age of the patient as to which ones I would use. But if I were taking care of this patient, I would always use calcium and vitamin D, and then I would maybe consider another medication. And again, what we're asking you to do is to compare and contrast the medicines and choose the ones which you think, based on what you have investigated for those different categories. So the centrally acting opioids, the NSAIDs, the non-opioids that peripherally act, the potential corticosteroids, which can be very useful for acute flares of almost anything, and then your specific medications associated with the diagnosis of osteoporosis. And finally, you'll do the same thing for muscle spasm. So what I'd like to do is, once these are all submitted in either your individual efforts or your group efforts, is that we'll take this table and we'll provide it for each of you as a resource for studying for the exam, and also for future reference in your lifespan classes. Next semester you'll have adult and older adult classes coming up. Oh wait, maybe it's not till the fall. Anyway, but you'll be doing those classes pretty soon, and this will be all helpful information for you. Let me know if you need anything else. We're excited about getting together for the final class and talking about these pharmacological agents, the pharmacokinetics, the pharmacodynamics, and the pharmacotherapeutics. And then the final thing that you're going to do for each of these, we talked about the rationale, which is here, but in this fifth row, you're going to actually write what the prescription would look like. You don't need to put patient name, allergies, any of that kind of information, but just what you would put in the signature or sig part of the prescription. So the drug name, the drug dosing. Remember, if it's a controlled substance, you need to write that number out in letters as well. But let us know if you have any questions. I hope this helps clarify. I think a couple of you have started working on this, but I would recommend that you go back and review and make sure that you have accomplished what we had expected. I hope the clarification of the assignment helps each of you. Marv and I thought it was relatively clear the first time, but when you look at it 2 or 3 different times, sometimes you can see there's a better way to say that, and hopefully this message, as well as the directions within the assignment, will help you accomplish that. Let us know, of course, if you need anything. Thanks.